Now, most people that go clubbing or to a concert will take it for granted that they enjoy the gig and get home safely, but a significant number of people, that is not the case.
Yes, Dr. Chris, good to have you on the show again.
Hi, Duffy.
Loads of us, I suppose most of us have been out at nightclub. We all go out, as Maura said there, we enjoy ourselves. But there's a downside to that as well.
Yes, there is, and actually nightclub medicine is what I call it, which is basically the study of the health of people who go clubbing. It's something I've been interested in for many years, since I was a medical student and the Stardust disaster occurred, and that left an indelible impression on me and my colleagues from back in 1981. And then as a young consultant in the early 90s in Liverpool, Cream, the big super club, approached us because they were having difficulty with drugs and gangs at their
Liverpool,
door.
is it?
Cream, yeah, which was like the Hacienda. Yeah, there were three big clubs. There was the Hacienda in Manchester, there was the Ministry of Sound in London, and there was Cream in Liverpool. And they were huge. I mean, they were attracting 3,000 punters a night. And they'd come from Cork, they'd come from Dublin, they'd come from Reykjavik and Amsterdam to Cream. So it was a huge, successful business. But of course it attracted difficulty, crime, criminals, gangs, drug dealing, all that kind of stuff. And they were threatened with closure, and they invited us to come in and give some advice about the problems of drugs and crime.
So Chris, you've been, as you said, nearly studying this and working within the area for years.
It's a sort of hobby of mine, and I thought we'd talk about it today because I was actually in London at a conference for medical students and paramedics, the Royal London, the famous helicopter site in London a couple of weeks ago, talking about the health issues of clubbing. And the message I left with them was that the real difficulty with clubs is fire, conflagration, like the Stardust.
Or like the dreadful tragedy.
And of course, ironically, the next week we had that horrible, desperate Brazilian catastrophe with about 230 young people dead. And of course, that is the ultimate hazard of going clubbing.
So you're just talking about a fire which will start and all that, but the other side, I suppose, the cold face of it that you'd see in your practice and as a consultant on a regular basis is, I suppose, the fallout from nightclubs in the sense of people that take a lot of drugs and alcohol together, or a mix of everything.
Absolutely, and in fact the conflagration, the fire situation is, for example, ultimately the product of the mixture of the things that tend to happen and affect clubs if they're badly run, which is basically criminality and the taking of drugs like cocaine, which makes people very violent and also very stupid and very reckless. So you have a mixture often of very criminally negligent or criminally stupid owners who pay no attention to the need for doors and exits and a safety policy. They allow people inside who have a lot of drink and drugs taken to do things like setting off fireworks. And of course, you know, every year there is an example like the Brazil fire. Every single year I go to conferences about this subject because it's huge, obviously, with police and authorities, you know, looking after people in their cities, clubbing. But every year there's a fresh fire, just like the Brazilian or Stardust disasters.
How have the drugs changed over the years?
Yeah, well, the drugs is probably the most obvious change from the point of view of the health carers, because really in the 80s and 90s there was only 2 or 3 types of drugs.
What were they?
Well, drink was always the number one drug, obviously. But into the drink you then put cannabis, you had cocaine coming in, and then of course you had ecstasy in the acid house situation in the late 80s and the early 90s. And I remember going to Cream in 1993, 94 as a young consultant with a little bit of a medical team, and I was amazed because Cream was a series of warehouses merged together with about 8 what we would call discotheques all joined up. There were 3,000 people, and there was absolutely no hint of trouble or menace. And I was amazed at this because when I had been younger, clubs were often places of difficulty and violence and stop.
But I think we should say, Chris, just before we go on that, I mean, there are very responsible nightclub owners out there, and the reality is it's not their fault sometimes that people are actually taking drugs unbeknownst to them in their nightclub.
Absolutely.
But what do you see coming in? Because we just want to show a little bit of footage here. This is the Drink Aware ad. Now, Chris, I am sure that you have these kind of situations on a regular basis in the emergency room.
Absolutely.
This is obviously a setup, but tell us what you see.
Yes, I mean, I've been involved with that situation. I've been involved with court cases and TV coverage of precisely this kind of carry-on in our waiting rooms, even in the hospitals in Cork and as well as in Liverpool and other places, where people who are fighting at the door of a club continue the fight in our waiting room. And, you know, we've had people coming in with batons and hurleys and CS gas canisters fighting in our emergency department waiting room. Of course, you can imagine the terror that creates for other people waiting to be seen.
But the reality is, I suppose, the new types of drugs, and you were saying, you know, though I was saying there, what types are they taking now? There's these novel compounds.
Yes.
Tell us what these are.
So it's have changed probably from 3 drugs to to 100 or so, 100 different types of
that
drugs.
was the point I was coming to, is that, you know, we've always had drink and drugs, a small number of drugs, but now we have 100 and more drugs. So there's an amazing proliferation and diversity and variety of drugs. And we got a hint of them when we had the head shop situation there in 2010. These hatches were opening in all the club areas of the cities of Dublin, Cork, Galway, Limerick, you name it. They were having pop-up shops selling drugs that were being purported to be organic alternatives,
That's the
legal.
whole hemp controversy.
Exactly.
Yeah.
And they were alternatives to cannabis and cocaine and LSD, and so they were basically artificial, chemically constructed drugs.
And is this what people are now buying online, these novel compounds?
Exactly. Now,
do we know what's in it?
Well, we do and we don't. The problem is that there are factories in China and Czech Republic and Russia where chemists are inventing new drugs. There are recipe books online, basically. They came from California, where else, in the early 80s. But when the internet developed, the recipes went online, and that's what drove the proliferation of synthetic or novel compounds.
How do you deal with that, though? If you're presented with somebody who's hyperventilating or
off their head,
off their whatever,
Yeah.
how do you deal with
It's
that when you
very
don't
difficult
know?
because, I mean, again, one of the reasons we're so passionate about preventing these sort of situations is because we're already dealing with overcrowded emergency departments. I make no apology for bringing up the subject of our departments
you're
being
right,
overcrowded.
yeah.
People worry, and you know they're afraid of coming to overcrowded emergency departments. So when we get these people coming out, exploding out the back of an ambulance, off their heads, and very, very violent, very often very, very violent, hallucinating, delirious, often sweaty, and very often requiring 3, 4, 5, 6 burly guards or security guys to restrain them, it's very frightening for everybody within the department, and it's incredibly disruptive. So the bottom line is we need a lot of strong hands. We have to restrain them physically, very often with handcuffs and blankets and so forth, and we have to give them huge doses of tranquilizers.
Doc, you want these doormen and bouncers to be trained up properly for all this.
Yeah.
In the nightclubs.
I mean, the good news, and you're absolutely right, Maura, to point out that there are very, very many well-run clubs, and I'm really proud to have been involved in the development of training and standards for clubs all over the UK and Ireland. For instance, we have this thing called Club Cork, and about 10 years ago, we spoke to all we were invited to Police HQ just across the road here in Anglesey Street, where all the club owners were brought in, and we had a kind of interdisciplinary conversation and a series of lectures about the hazards, the drugs, the drink, the violence, the fighting, and also the environmental hazards, the
And how
mezzanine
to
floor.
spot it, maybe.
All the very many
Yeah.
hazards in a club. And as a result of that, we set up a program where myself and other doctors and paramedics and guards went into all the major clubs in Cork and trained the staff for a day and a half of a residential course. And I believe, I think that really helped to cap the level of problems coming out of the clubs.
So reality is, if the people and the staff of these clubs were more highly trained, and maybe they'd spot more before the situation got out of control and eject those people.
The bottom line is that the Brazilian fire, the Stardust, can be easily prevented with simple foresight, knowing about the hazards. Just the same way, and on a weekly basis, you can prevent violence, you can prevent the kind of tragedies you see with drug deaths in young people. These are all easily preventable by an alert, aware and trained workforce in any club.
You know, it's scary when you think about it, though, the amount of medicines that were interrupted and actually found coming into the country last year by the Irish Medicines Board, and that these drugs are still coming in all the time. And I suppose tighter, you know, you have to be tighter on this. It's very difficult, though,
It's
you know,
very,
people
very
buying
difficult,
online.
I suppose another side, then Maura say you have people coming into the doc, and the doctors know what this person's after taking.
That's what we're saying.
So
He's
and
lying
just,
there.
and
You
you're just
have to
lying there. How
treat
do you do
him.
it?
Yeah, and you actually can't know, because the drug may only have been invented and sold last week. It'll be tweaked again by a molecule or two, and it'll be a different identity drug. And the laboratories are chasing their tail to try and catch up with these in terms of identifying them. So the reality is you just have to deal with what you have in front of you. So it's a question of restraint, tranquilizing, putting them in a quiet room, monitoring and treating things as they happen, the heart attack, the headache, the stroke, whatever. You treat them as you find them. But you often will not know until autopsy. Or months later.
Have you lost people in this situation? Do you lose people regularly?
Well, I mean, one of the commonest causes of death in custody, for instance, in police cells, would be a mixture of stimulant drugs like cocaine or amphetamine, or these head shop drugs and drink. And every week or two, you hear about a tragedy of someone dying because they were being restrained, because they were so violent in a cell or a situation like that.
I think the piece we saw there, Maura, from the Drink Aware ad, it has to be one of the most frightening situations anybody could find themselves in. Could you imagine if you're just an ordinary random
But that's what I
punter
mean, sitting there.
sitting there, and next second this row breaks out with people who are off their head and drink or drugs or whatever, and just like that poor man there.
And the reality is, I mean, you're doctors. You're not supposed to go around turning into security guards restraining these people. It's actually unfair, to be honest about things, to bring this into an
But it's unfair on
emergency
the
room.
guards as well.
It's
you
unfair
know,
on
it's unfair
everyone
on everybody.
involved. It's wrong.
Dr. Chris,
Okay.
thank you very much.
I hope that lots of people are listening will
I hope so.
listen to this and actually, take this on board and,
not be
training
stupid enough
can
to
see
take them in the
things.
first place.
Well, yeah, but even from a training perspective,
Yeah.
that you can intervene at an earlier stage before this can happen and spot this as it's happening under your nose, maybe in a club. Thanks very much,
Absolutely.
Chris.
Thanks.